Welcome to Ulosca channel. Access all nursing practice questions. ATI Nursing 109 Final Assessment Exam Practice Questions with Answers.
Question 1. Which of the following actions best prevents healthcare-associated infections? A. Wearing sterile gloves at all times. B. Frequent hand hygiene. C. Using room air humidifiers. D. Wearing double masks. Which one is the correct answer? The correct answer is B. Frequent hand hygiene. Explanation. Hand hygiene is the most important way to prevent the spread of infections in healthcare. It reduces transmission of pathogens from patient to patient and is effective even more than gloves or masks in routine care. Question 2. Which finding requires immediate action in a postoperative patient? A. Pain score 5-10. B. Redness around the surgical site. C. Sudden shortness of breath. D. Nausea after eating. Which one is the correct answer? The correct answer is C. Sudden shortness of breath. Explanation. Sudden shortness of breath post-surgery may indicate a life-threatening complication like pulmonary embolism or pneumonia, requiring immediate medical intervention to prevent respiratory failure or death. Question 3. Which nursing intervention reduces the risk of pressure ulcers? A. Keeping the patient supine for longer periods. B. Repositioning the patient every 2 hours. C. Massaging reddened skin areas. D. Providing only liquid meals. Which one is the correct answer? The correct answer is B. Repositioning the patient every 2 hours. Explanation. Regular repositioning improves blood flow and reduces prolonged pressure on skin tissues, which is essential in preventing skin breakdown and pressure injuries in immobile patients. Question 4. Which dietary choice is most appropriate for a patient on a low-sodium diet? A. Canned soup. B. Fresh fruit salad. C. Salted peanuts. D. Processed cheese. Which one is the correct answer? The correct answer is B. Fresh fruit salad. Explanation. Fresh fruits are naturally low in sodium and high in nutrients, making them suitable for patients needing to reduce salt intake, unlike processed or canned foods, which typically contain high sodium levels. Question 5. Which technique is used to assess the apical pulse? A. Counting radial beats. B. Auscultating at the 5th intercostal space, midclavicular line. C. Placing 2 fingers on the carotid artery. D. Using a pulse oximeter. Which one is the correct answer? The correct answer is B. Auscultating at the 5th intercostal space, midclavicular line. Explanation. The apical pulse is best measured with a stethoscope placed at the apex of the heart, providing an accurate assessment of heart rhythm and rate, especially in irregular pulses. Question 6. Which is a common symptom of urinary tract infection in older adults? A. Increased appetite. B. Confusion or delirium. C. Hypertension. D. Weight gain. Which one is the correct answer? The correct answer is B. Confusion or delirium. Explanation. UTIs in older adults can cause atypical symptoms like confusion or delirium rather than the typical urinary complaints seen in younger adults, making it a common reason for sudden mental status changes in elderly patients. Question 7. A patient receiving oxygen via nasal cannula at 4 Lmin should be monitored for which complication? A. Hypoxia. B. Oxygen toxicity. C. Dehydration. D. Tachypnea. Which one is the correct answer? The correct answer is B. Oxygen toxicity. Explanation: oxygen toxicity can occur when high concentrations of oxygen are given for prolonged periods. At 4 min or higher, especially in patients with chronic respiratory conditions, monitoring for toxicity is critical. Question 8. Which action promotes patient safety during ambulation? A. Allowing the patient to walk unassisted after surgery. B. Applying non-slip footwear. C. Encouraging running in the hallway. D. Removing assistive devices. Which one is the correct answer? The correct answer is B. Applying non-slip footwear. Explanation: non-slip footwear reduces the risk of falls, especially in postoperative or elderly patients, by providing better grip on the floor and preventing slips during ambulation. Question 9. Which laboratory value is a priority to report for a patient on anticoagulant therapy? A. INR of 4.5. B. Hemoglobin of 14 GDL. C. Sodium of 138 milliequivalent L. D. Potassium of 4.0 milliequivalent L. Which one is the correct answer? The correct answer is A. INR of 4.5. Explanation: a high INR indicates an increased risk of bleeding in patients on anticoagulants like warfarin, requiring dosage adjustment or reversal therapy to prevent life-threatening hemorrhage. Question 10. A nurse is reinforcing teaching about incentive spirometer use. Which statement by the patient indicates understanding? A. I will breathe out quickly into the device. B. I will use it once a day before meals. C. I will inhale slowly and hold my breath. D. I will use it after I sleep only. Which one is the correct answer? The correct answer is C. I will inhale slowly and hold my breath. Explanation: correct use involves slow inhalation with a breath hold, which helps fully expand the lungs, prevent atelectasis, and improve oxygenation, especially after surgery or prolonged bed rest.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.